So here the topic is stability of the cervical vertebra. So if we take cervical spine, thoracic spine, lumbar spine, sacral spine and coccyx, okay, anterior, posterior. Here the stability of the cervical spine, it is different from thoracic, lumbar and sacral. Even though it is different here, the cervical spine has more mobility. Cervical spine has more mobility compared to thoracic and lumbar. So it has more mobility. Even though it has more mobility here, cervical spine, suppose if we take cervical spine, here top of cervical spine will be having head. So always this head is going to give a kind of compressive axial compression force to the cervical spine. So here we need stability at the two joints, especially two joints. First one, atlanto-occipital joint. Here we need stability, and second one, atlanto-axial joint, we need stability. These two joint stability required to maintain the head in the normal position, and at the same time, so here atlas means C1, axis means C2. So again from C3 to C7 we need stability for the movements of the flexion, extension, lateral flexion and rotation. So for all these movements we need stability means finally what it means, even though we do flexion, extension, lateral flexion and rotation, again after the ending of that movement, again cervical spine should come to the neutral position. That's nothing but stability. And one more in same stability, if here axial compression, this head is going to give axial compression, or maybe distraction, axial compression, or maybe distraction force, or maybe torsion, or maybe torsional force, or maybe shear forces. So whatever the forces are acting on the cervical spine, after the removal of these forces, cervical spine should come to the neutral position, otherwise normal position. That is nothing but stability. So again, if we see the shape of the atlas, in this shape of the atlas we don't have body. There is no body in the atlas, and there is no spinous process in the atlas. So it is going to look like a ring shape, okay, ring shape. So here in this ring, the foramen for the spinal cord will be large. So that what is the use of this large foramen means, even though we are doing flexion, extension, lateral flexion and rotation movements, so in this large foramen the spinal cord can be free from the any other compression means, suppose if there is no big foramen, suppose if it is small foramen, if we are doing flexion, extension, lateral flexion and rotation movements, so that time what will happen, the spinal cord may be go to compression. It may get compression because of the bone, because of this first cervical vertebral bone. So to prevent that, here already foramen of the atlas is large. So again, next point, now if we come to ligaments, so here we know so many ligaments in our cervical region. So here ligaments will be having, first one, anterior atlanto-axial ligament, and posterior atlanto-axial ligament will be having, and then transverse atlantal ligament, and alar ligaments will be having here, and special ligament, ligamentum nunchae will be having, and one more, tectorial membrane. So these are all the ligaments we are having here. So these ligaments are going to provide stability. This already we discussed when we discussed about atlanto-axial joint and atlanto-occipital joint. This already we discussed. If you discuss, so these are the ligaments which are going to provide stability to the cervical vertebra. Now if we come to muscles, which muscles can provide stability to the cervical vertebra, especially multifidus muscle is going to provide stability to the cervical spine, and interspinalis muscle, and semispinalis muscle, and semispinalis cervicis. So these are the four muscles. These are going to provide stability to the cervical spine. So these ligaments are going to provide stability. We'll see how they will provide stability at the end. Already we discussed. We'll see at the end. Okay. Suppose if we see, this is the head of the patient. This is the head of the one individual. Okay. This is the head of the one individual. So here we'll be having one joint. The joint name is atlanto-occipital joint. Behind this we'll be having one more joint, that is atlanto-axial joint. Of this, here we'll be having C3, C4, C5, C6, C7. Okay, C7. So this is cervical spine. So if we see, suppose for example, head weight is almost, we'll take it like a 4 kg. Suppose the weight of the head is 4 kg. So now 4 kg weight will come to the atlanto-occipital joint. If we observe one point, at atlanto-occipital joint and atlanto-axial joint, there is no disc. there is no intervertebral disc in these two joints. So because of there is no disc, the weight of this head, it is going to give compressive, it is going to give compressive force. That compressive force directly it will come to the articular facets of the atlanto-occipital joint. From there it will transfer to the atlanto-axial joint, atlanto-axial joint. Here if we take axis, this is axis, no, C2 axis, here will be having body. If body is there means pakka there may be a chance for the IV, intervertebral disc. So between C2 and C3 here will be having intervertebral disc. So weight of the head will come to atlanto-occipital joint, from there atlanto-axial joint, from here it will transfer to the IVD, from here it will enter into the body of the C3 vertebra, So when the weight is transferring, like that, how it will exchange, it will exchange in three parts. It will transfer from C2 to C3, it will come in three ways. First one, central portion. In this central portion, which structures will be there? Body of the vertebra, at the same time intervertebral disc. So central portion, body of the vertebra and intervertebral disc. So this is the central portion. And lateral sides. So what will be there on lateral sides? It's easy, no? Facet joints. So lateral sides, so both lateral sides and facet joints will be there. What it means? Suppose if we take one vertebra, so this is the body of the vertebra. So here suppose spinous process, transverse process, superior inferior faces will be there. Central weight transmission, central weight or axial compression transmission will occur through the body of the vertebra and IVD. If IVD is present here, IVD. So this is central. And lateral side, this side facet joints and this side facet joints. So most of the weight will transfer to the central portion only. So in this way the weight will transfer to the, in this way, the axial compression or weight will transfer from the head to the C7 vertebra, And one more point here, the compression of the head, load, compressive loads are less when the patient or person is standing or sitting or lying. So compression forces are less when the patient or person is standing, sitting, lying, whatever. But when the compression force will be more means extreme flexion and extension position of the neck, extreme flexion and extension movements of the neck. So at the end level of maximum flexion, at the end level of maximum extension, the compression forces will be more on the cervical spine. And one more point regarding stability, if we take facet joint capsules, the facet joint capsules are little weak, or otherwise we can say like loose in the cervical spine. So because of that loose of this facet joint capsule, here cervical spine will get more range of motion. So because of this loose, we are getting more range of motion. At the same time, we are getting less stability. So here what it means, if any structure is having more mobility, that structure will be having less stability. Example, shoulder joint. So shoulder joint here will be having more mobility, okay, RVM will be more, so that stability is less. If we take hip joint, here RVM is less, but stability is more in hip joint. So same like that here in cervical spine, if we take only facet joint capsules, these capsules are loose in the cervical spine. Because of that, RVM will be more. And one more, uncinate processes. This we can see only cervical spine. If we take cervical spine, here it will be having uncinate process. Will be there. So with the age, the enlargement of uncinate process will increase. Up to what age? Up to 19 years. The uncinate process mean enlargement will increase because of this uncinate process. So here this uncinate process structure, because of the structure of that, it is going to provide stability for the lateral flexion and rotation of the cervical spine. So now we'll see final picture of the stability of the cervical vertebra. First one, atlanto-occipital joint. If we take atlanto-occipital joint, suppose here forward flexion, nothing but flexion of the cervical spine will be limited by the atlas will touch the dense of axis. So because of this, the forward flexion of the cervical spine will be limited, and at the same time stretching of the tectorial membrane. So it is going to provide passive tension. It is nothing but passive tension. So here atlanto-occipital joint will be in stability when it is doing forward flexion. Because of the passive tension in the tectorial membrane, nothing but stretching of the tectorial membrane is going to provide stability for the atlanto-occipital joint, and at the same time dense also is going to provide stability for the atlanto-occipital joint. Okay, now we will see atlanto-axial joint. How here the forward flexion of the atlanto-axial joint is limited, it is going to limited by the passive tension in the posterior atlantoaxial ligament, so passive tension nothing but stretching, so stretching of the posterior atlantoaxial ligament is going to provide the stability in the flexion, and at the same time with this posterior atlantoaxial ligament here tectorial membrane also will involve, and at the same time here if we see extension moment, extension is limited by the passive tension in the anterior atlantoaxial ligament, and lateral flexion. If we see lateral flexion, these are now we are discussing about atlantoaxial joint. So here lateral flexion, the lateral flexion and lateral rotation are restricted by the because of alar ligaments. So restriction means here they are going to prevent the further range of the cervical spine. So alar ligaments are going to provide stability in lateral flexion and rotation of this atlantoaxial ligament, and at the same time atlantoaxial joint, and at the same time here one more ligament, the legendary ligament in atlantoaxial joint, transverse atlantal ligament. So this transverse atlantal ligament also going to provide the stability in the lateral flexion and rotation of the atlantoaxial joint. Now we will see from cervical C2 to C7 vertebrae. Here we have to see one point. Atlantoaxial joint is a pivot joint. It is a synovial joint, pivot joint. Here rotation only, the purely rotation movement will happen. Even though with rotation here there may be a chance of slight flexion, extension and lateral flexion. If the flexion is happening, the flexion is resisted by or supported by these structures. If the extension is happening, it is supported by these structures. If lateral flexion, rotation are happening, it is supported by these structures. That we should understand. Okay. Now here cervical spine C2 to C7. So here flexion of the cervical spine is limited by the posterior longitudinal ligament. So that means it is going to provide stability, and at the same time ligamentum flavum also is going to provide stability, and at the same time ligamentum nunchae. So this is the extension of the ligament. This is the extensor ligament. Okay, extensor means it is the extension of another ligament. So here flexion is restricted or protected by the posterior longitudinal ligament, ligamentum flavum, and at the same time ligamentum nunchae. So here extension movement is limited by the spinous process contact. What is the spinous process contact means? Suppose this spine, if we are doing extension, this is anterior, this is posterior, these are all ligament names. Why I am saying like very shortcut, we discussed already. These are all we discussed in structure of the vertebral column, ligaments of the vertebral column we discussed already. So that's why I'm going like shortcut fast. So here it is anterior, this is posterior. If the patient is doing extension, spinous process will come together in extension, spinous process will separate in flexion. So here spinous process contact is going to stop the further extension of the cervical spine, and at the same time passive tension in the anterior longitudinal ligament. Passive tension means there is a stretching of the anterior longitudinal ligament is going to stop the further extension movement, and lateral flexion and rotation of the remaining C2 to C7 cervical vertebrae are limited or restricted by the uncinate processes. This is one point, uncinate processes. This we can see only in cervical spine, uncinate processes. So these are going to provide the stability to the lateral flexion and rotation, and at the same time it is going to, and at the same time annulus fibrosus. So these structures also are going to provide stability during C2 to C7 lateral flexion and rotation, and one more, facet joints orientation in cervical spine we discussed. It's a backward, upward and medially bump. So it is going to show 45-degree angle with the frontal plane. Facet joints orientation. So because of this 45 degrees with frontal plane orientation, backward, upward, medially. So here all the movements are possible. Means flexion, extension, lateral flexion, rotation of the cervical spine are possible. So even though here these movements are possible, somehow these facet joints are going to provide the stability to the cervical spine from C2 to C7 while doing lateral flexion and rotation movement of the cervical spine. So this is completely about stability of the cervical vertebra. So if we want to understand finally what and all coming in the stability, either ligaments or muscles and bony structures, and some joints. So this is about stability of the cervical vertebra. Clear?